Hashimoto's thyroiditis is an autoimmune disorder that affects the thyroid gland, a small butterfly-shaped organ at the base of your neck. Over time, the immune system mistakenly attacks the thyroid, leading to chronic inflammation. This process can be slow and subtle, making early symptoms easy to overlook. In this video, we'll explore how Hashimoto's thyroiditis develops, from its initial stages to its long-term effects on the body. Understanding this progression is key to recognizing symptoms and seeking timely treatment. Let's begin by looking at what triggers this autoimmune response and how it sets the stage for thyroid dysfunction. In Hashimoto's thyroiditis, the immune system becomes confused and starts to see the thyroid gland as a threat. This triggers the production of antibodies that specifically target thyroid cells. Over time, these antibodies cause ongoing inflammation and gradual destruction of thyroid tissue. The exact cause of this immune misfire isn't fully understood, but genetic factors, environmental triggers, and even certain infections may play a role. As the immune attack continues, the thyroid's ability to produce hormones is slowly compromised, setting the stage for further changes in the body. During the early stages of Hashimoto's thyroiditis, most people don't notice any symptoms. The immune system's attack on the thyroid is slow and may go undetected for years. Blood tests might show the presence of thyroid antibodies, but thyroid hormone levels often remain within the normal range. This silent progression means that many individuals are unaware of the underlying autoimmune process until more significant changes occur. It's a phase where the body is quietly adapting to the ongoing inflammation, and the thyroid is still able to compensate for the damage. As Hashimoto's progresses, the immune system produces increasing amounts of antibodies, such as antithyroid peroxidase, TPO, and antithyroglobulin antibodies. These antibodies are markers of the autoimmune process and can be detected through blood tests. Their presence indicates that the immune system is actively targeting the thyroid, even if symptoms are not yet apparent. Over time, the buildup of these antibodies leads to more pronounced inflammation and damage to thyroid tissue, gradually impairing its function. With ongoing antibody production, the thyroid gland becomes inflamed. This inflammation, known as thyroiditis, can cause the gland to swell and sometimes become tender. However, many people still do not experience noticeable symptoms at this stage. The inflammation is a sign that the immune system is actively attacking the thyroid, and over time, this can lead to scarring and loss of healthy thyroid tissue. The gland's ability to produce hormones starts to decline, but the process is gradual. During the compensatory phase, the thyroid gland works harder to maintain normal hormone levels despite ongoing damage. The pituitary gland in the brain senses even slight drops in thyroid hormone and responds by releasing more thyroid-stimulating hormone, TSH. This extra stimulation pushes the thyroid to keep up with the body's needs. For a while, this compensation is effective, and blood tests may still show normal thyroid hormone levels. However, the underlying damage continues to accumulate. As Hashimoto's thyroiditis advances, the thyroid's ability to compensate begins to wane. This leads to a stage called subclinical hypothyroidism. In this phase, TSH levels are elevated, indicating the pituitary is working harder to stimulate the thyroid, but thyroid hormone levels, T4 and T3, are still within the normal range. People may start to notice mild symptoms, such as fatigue or slight weight gain, but these are often attributed to other causes. Subclinical hypothyroidism can persist for years before progressing further. Eventually, as more thyroid tissue is destroyed, the gland can no longer keep up with the body's demands. This is when symptoms of hypothyroidism become more noticeable. People may experience fatigue, weight gain, sensitivity to cold, dry skin, hair loss, constipation, and even depression. The severity and combination of symptoms can vary widely from person to person. Recognizing these signs is important for early diagnosis and management of Hashimoto's thyroiditis. When the thyroid can no longer produce enough hormones, clinical hypothyroidism develops. Blood tests now show high TSH and low thyroid hormone levels. Symptoms become more pronounced and can affect nearly every system in the body. At this stage, treatment with thyroid hormone replacement is usually necessary to restore normal function and alleviate symptoms. Early intervention can help prevent complications and improve quality of life. Over time, chronic inflammation and scarring cause the thyroid gland to shrink, a process known as atrophy. The gland may become small and firm, losing much of its normal function. This shrinkage is a sign of long-standing Hashimoto's thyroiditis and usually means that the thyroid is no longer able to produce adequate hormones on its own. Regular monitoring and ongoing treatment are essential at this stage to maintain overall health. If left untreated, Hashimoto's thyroiditis can lead to a range of long-term complications. These may include high cholesterol, heart disease, infertility, and in rare cases, myxedema coma, a life-threatening condition. The risk of developing other autoimmune disorders, such as type 1 diabetes or rheumatoid arthritis, is also increased. Regular follow-up and appropriate management can help minimize these risks and ensure a better quality of life. Diagnosing Hashimoto's thyroiditis involves a combination of clinical evaluation, blood tests, and sometimes imaging studies. Doctors look for symptoms of hypothyroidism, check TSH and thyroid hormone levels, and test for thyroid antibodies. In some cases, an ultrasound of the thyroid may be performed to assess its size and structure. Early diagnosis is important for starting treatment before significant damage occurs. Testing for thyroid antibodies is a key part of diagnosing Hashimoto's. The most common antibodies checked are antithyroid peroxidase, TPO, and antithyroglobulin antibodies. High levels of these antibodies confirm the autoimmune nature of the disease, even if thyroid hormone levels are still normal. This helps distinguish Hashimoto's from other causes of thyroid dysfunction. A thyroid ultrasound can reveal changes in the gland's size, texture, and structure. In Hashimoto's, the thyroid may appear irregular, with areas of scarring or reduced echogenicity. Nodules or cysts may also be detected. These imaging findings, combined with blood tests, provide a clearer picture of the disease's progression and help guide treatment decisions. Hashimoto's thyroiditis is influenced by both genetic and environmental factors. A family history of autoimmune diseases increases the risk, and certain environmental triggers, such as excessive iodine intake, radiation exposure, or viral infections, may initiate or worsen the disease. Understanding these risk factors can help with early detection and prevention strategies. Hashimoto's thyroiditis is a classic example of an autoimmune disease where the body's immune system mistakenly attacks its own tissues. This concept is central to understanding why the disease develops and how it progresses. Autoimmune diseases can affect many organs and often run in families, highlighting the importance of genetic predisposition. The immune system is designed to protect the body from harmful invaders like bacteria and viruses. In autoimmune diseases, however, this defense system becomes misdirected and attacks healthy tissues. In Hashimoto's, the thyroid gland is the target, leading to chronic inflammation and gradual loss of function. Understanding how the immune system works helps explain the progression of Hashimoto's thyroiditis. The thyroid gland produces hormones that regulate metabolism, energy levels, and many other vital functions. When the thyroid is damaged by Hashimoto's, hormone production declines, leading to a slowdown in these processes. This is why symptoms like fatigue, weight gain, and cold intolerance are so common in hypothyroidism. The body maintains thyroid hormone levels through a feedback loop involving the pituitary gland and the thyroid. When thyroid hormone levels drop, the pituitary releases more TSH to stimulate the thyroid. In Hashimoto's, this loop is disrupted as the thyroid becomes less responsive, leading to persistently high TSH and low thyroid hormone levels. The symptoms of Hashimoto's thyroiditis often develop gradually. Early on, people may feel perfectly healthy, but as the disease progresses, symptoms like fatigue, weight gain, and mood changes become more noticeable. Over months or years, these symptoms can worsen if the condition is not treated, affecting daily life and overall well-being. One of the most common symptoms of Hashimoto's is persistent fatigue. As thyroid hormone levels drop, the body's metabolism slows down, leading to a constant feeling of tiredness. This fatigue can be profound and may not improve with rest, making it difficult to carry out daily activities. As the thyroid slows, metabolism decreases, making it easier to gain weight even without changes in diet or activity. This weight gain is often gradual and can be frustrating for those affected. Managing weight becomes more challenging as the disease progresses, highlighting the importance of early diagnosis and treatment. Hashimoto's can also affect mood and mental function. People may experience depression, anxiety, memory problems, or difficulty concentrating. These changes are linked to low thyroid hormone levels and can significantly impact quality of life. Recognizing these symptoms is important for comprehensive care. Physical symptoms of Hashimoto's include dry skin, hair loss, brittle nails, and sensitivity to cold. These changes result from the body's slowed metabolism and reduced hormone production. Over time, these symptoms can become more pronounced, affecting appearance and comfort. Hashimoto's can slow down many body systems, including digestion and reproduction. Constipation is a common complaint, and women may experience irregular menstrual cycles or fertility problems. These effects are due to the widespread influence of thyroid hormones on various organs. In some cases, the thyroid gland may enlarge, forming a goiter. This swelling can be visible at the front of the neck and may cause discomfort or difficulty swallowing. Goiters are more common in the early or middle stages of Hashimoto's, before the gland shrinks due to scarring. After the goiter phase, continued immune attack and scarring can cause the thyroid to shrink and become fibrotic. This atrophy marks the late stage of Hashimoto's, where the gland is small, firm, and largely non-functional. At this point, lifelong hormone replacement is usually required. Regular monitoring is essential for managing Hashimoto's thyroiditis. Doctors track TSH, T4, and antibody levels over time to assess disease activity and adjust treatment as needed. Monitoring helps catch changes early and ensures that hormone replacement therapy is effective. The mainstay of treatment for Hashimoto's thyroiditis is thyroid hormone replacement, usually with levothyroxine. This medication restores normal hormone levels and relieves symptoms. Treatment is tailored to each individual, with regular follow-up to ensure the correct dose and monitor for side effects. Living with Hashimoto's thyroiditis often requires lifestyle adjustments. A balanced diet, regular exercise, and stress management can help support overall health. Support groups and counseling may also be beneficial for coping with the emotional impact of chronic illness. In rare cases, Hashimoto's thyroiditis may go into remission, especially if detected and treated early. However, most people require lifelong management. Ongoing research aims to better understand the factors that influence remission and how to promote long-term thyroid health. Hashimoto's thyroiditis can also affect children and adolescents. The disease may present differently in younger people, sometimes causing growth delays, puberty issues, or learning difficulties. Early diagnosis and treatment are crucial for healthy development. Women with Hashimoto's thyroiditis may face special challenges during pregnancy. Thyroid hormone needs often increase, and careful monitoring is essential to ensure a healthy pregnancy and baby. Untreated hypothyroidism can lead to complications, so preconception planning and regular checkups are important. Having Hashimoto's increases the risk of developing other autoimmune diseases, such as type 1 diabetes, celiac disease, or rheumatoid arthritis. This is due to shared genetic and immune system factors. Regular screening for associated conditions is recommended for people with Hashimoto's. Living with Hashimoto's can impact quality of life, especially if symptoms are not well controlled. Fatigue, mood changes, and physical symptoms can affect work, relationships, and daily activities. With proper treatment and support, most people can lead healthy, fulfilling lives. Ongoing research is exploring new ways to diagnose, treat, and even prevent Hashimoto's thyroiditis. Advances in genetics, immunology, and personalized medicine offer hope for better outcomes in the future. Staying informed about new developments can empower patients and healthcare providers alike. Many people with Hashimoto's thyroiditis share similar journeys, from the frustration of vague symptoms to the relief of diagnosis and effective treatment. Patient stories highlight the importance of persistence, self-advocacy, and support from healthcare professionals and loved ones. The emotional impact of Hashimoto's thyroiditis should not be underestimated. Anxiety, depression, and mood swings are common and may be related to both hormonal changes and the stress of living with a chronic illness. Mental health support is an important part of comprehensive care. While no specific diet can cure Hashimoto's, some people find that certain dietary changes help manage symptoms. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains supports overall health. Avoiding excessive iodine and gluten may benefit some individuals, but dietary changes should be discussed with a healthcare provider. Regular physical activity can help manage symptoms of Hashimoto's thyroiditis, including fatigue and weight gain. Exercise also supports mental health and cardiovascular fitness. It's important to choose activities that are enjoyable and sustainable, and to listen to your body's signals. Chronic stress can worsen autoimmune diseases like Hashimoto's. Stress management techniques such as mindfulness, meditation, and relaxation exercises can help reduce flare-ups and improve overall well-being. Building a strong support network is also beneficial. People with Hashimoto's thyroiditis may also have other health conditions, such as anemia, high cholesterol, or vitamin deficiencies. Regular checkups and comprehensive care are important for managing these associated issues and maintaining overall health. Catching Hashimoto's thyroiditis early can make a big difference in outcomes. Early detection allows for prompt treatment, which can prevent severe symptoms and complications. Regular health screenings and awareness of family history are key steps in early diagnosis. To sum up, Hashimoto's thyroiditis is a chronic autoimmune disease that develops slowly over time. It begins with silent immune attacks, progresses through stages of compensation and subclinical hypothyroidism, and eventually leads to overt hypothyroidism and gland atrophy. With early diagnosis, regular monitoring, and appropriate treatment, most people can manage the disease effectively and maintain a good quality of life. Living with Hashimoto's thyroiditis can be challenging, but with the right knowledge and support, it is manageable. Advances in medicine continue to improve diagnosis and treatment options, offering hope for even better outcomes in the future. Remember, you are not alone. Many people successfully manage Hashimoto's and lead full, active lives.